Today I'll tell you something about cataract surgeries. Hi, I'm Dr. Ajay Sharma, founder and CMD of IQ Vision Private Limited. Every human being, more or less in an age group of 50 to 70, they tend to develop cataract. But when they develop cataract, they all fear, wow, we have to go for a surgery. Shall I go for a surgery? Is it painful? What is going to happen? There are so many questions in a patient's mind. So I'll tell you, in a cataract surgery, there is no pain. There is no injection. There are no stitches, and it is a painless surgery. Yes, patient is apprehensive because once patient is lying on an operation table, patient feels that operation is going on, but to add very clearly, we give you anesthetic drops where the anesthesia makes your eye numb. There is a movement of the eye, you can move around, but you won't feel pain because that is the effect of the anesthesia. And even during the procedure while we are operating, so you won't feel pain. If you feel there is some, you need to tell us and we instill more drops, and within few seconds the pain goes away. Post-operatively, once the surgery is over, we put some drops in your eyes and cover your eye with a bandage so that there is no chance of infection while you are going home, while you are traveling. And after that, you can remove your bandage at home after 2 to 3 hours of the surgery. During surgery, I would like to add, we ask you to be patient, have patience, be straight, don't move your head, because we are doing surgery under a microscope, and even a simple movement of few millimeters can make your eye move a lot and the surgeon can lose control on the surgery. So don't move. You can come on the day of the surgery after having your normal food, and surgery can be done. Even at home, you can go back and have on the day of surgery some light food, and then later on your normal food from the next very day. Okay, so there are few surgeries in cataract which I can say are even bladeless. Now why? Because there is a surgery called as femto laser assisted cataract surgery where the incisions are made by a laser, so you can call it a bladeless surgery, and then it is again a painless surgery. You don't feel pain during the surgery. Pre-operative evaluation again is very important. You have to go to the doctor, you have to find out what is your lens power, how mature is your cataract, whether your retina is healthy or not, and whether you are having some other disease of eye along with the cataract, maybe a glaucoma or a retinal pathology. All these are checked before the surgery, and then we decide on what type of lens we should be putting in your eye, whether it is a monofocal lens, whether it is a bifocal lens or a trifocal lens. That again the doctor will be deciding the best for you, and once the surgery is done, you have to be instructed how post-op instructions are given, and you have to take care of your eye post-operatively. Very important for 5 to 7 days, and after 7 days there is again a consultancy with your doctor, and he tells you more about how to put drops for another 3 weeks. So after 4 weeks we can stop the medicines, and you can see nicely within the 48 hours. You will be able to see properly after the surgery if your surgery is nicely done. And after 7 days you can move around, you can go out, you can do your job. And but yes, overall for a period of 4 weeks you have to put the medicine, and 4th week you go again to the doctor and find out what is the concluding drops what you have to put in your eyes after the surgery.